My name is Antonio. I'm a student at the University of Essex, currently studying psychology with neuroscience, and I'm also a 24-year-old mental health activist campaigning for anti-racism within the mental health space.
My name is Lucy. I'm one of the deputy lead nurses for mental health over at Chelsea and Westminster NHS Foundation Trust.
Yeah, so what I've got here are questions that we've sourced from young people, actual questions that we've gathered from young people about what they most want to find out from someone like yourself who's a mental health lead. And I guess, some of these questions also are relatable to me because of my own lived experience. So for context, I was diagnosed with schizophrenia at the age of 15, 16. I spent 2 years in a psychiatric ward, and my journey starts at child adolescent mental health service, goes to psychiatric ward, out to early intervention service, to adult mental health service, to fortunately now with my GP. And so, I can see from these questions that we've got here that there are questions I've asked my psychiatrists in the past in my services. When we're looking at young people and looking at anxiety and depression, people say teenage years are the most stressful years in your life, or one of the most stressful years in your life. You go through education, that's that pressure. You go through peer pressure, the social circle. So do you think there's something deeper to why anxiety and depression is so common in young people?
For sure, I think you're right completely in that group of young people, in that I think sometimes we take away from how difficult it actually is in those years. We talk about it as clinicians sometimes, that actually with hindsight it's a beautiful thing.
Right.
When we're adults we can kind of say, maybe our young years were the best, even though they were really difficult at the time. And I think we take away from young people how there's so many firsts in those years, there's so much change in those years, and there's so much pressure, particularly for young people now, in the last few years where they've had all these changes to their lives, COVID, all that stuff that comes with it. I think there is a pressure that kind of we can sort of lose sight of when we're adults.
Yeah.
There's always this ticking time bomb of, your year's ending and you've got these exams, or you're going up to high school, or you're going to uni, or there's an expectation to do this, or have a job, and I think sometimes people feel a little bit like reluctant to seek help because they're not sure how much they can give to each thing. And I think there is that with young people, is there's so much pressure on them from so many different areas. And I think sometimes it's really hard for themselves to let themselves go and let themselves be vulnerable.
Yeah.
Because they're worried about, getting behind, or they're worried about what people might think of them at school, or having special plans at school might mean they're different, or dealing with all those things though that we kind of underestimate as an adult.
I can definitely relate to 99% of what you said. As I said, I guess that's the anxiety as well, to thinking if I don't achieve, then what is, it's that black or white sort of thinking. I think a lot of people without conversation never find that grey area. And it's interesting you mentioned that we speak about depression as well, because every single picture you see, when you take school pictures, every single picture I've taken, I had the biggest smile, but behind that smile was actually a lot going on, a lot that I wasn't even aware of myself, because mental health wasn't, a topic of discussion, how I grew up. And thinking of it now, where I'm so open as an activist, I share my story, I have my friends, and I'm telling you, even in a nightclub, I have my friends come up to me and talk to me about their mental health, and I'm like to them, why are you telling me? Why are you not speaking to someone about this? And the answer is always, because I've heard you talking about it, so I know you understand. I don't want to tell anyone else further than that. So I think the lack of conversation also is an issue that adds on to, that depression, anxiety.
There's also really challenging issues for young people in seeking care and support. And with the current kind of crisis in mental health, we are seeing so many young people slip through the cracks and not be picked up by services that they really should be picked up by. And whilst that's not a fault of the service alone, but a wider thing with policy and government and things and funding, I think we need to acknowledge how difficult it is for these young people at the moment. I think if it's the first time that you're experiencing a mental health problem, you don't know that it's ever going to end. And I think that's again, the importance of kind of supporting these young people through this crisis and giving them as much as we can so that they can take as much as they can from it. And I do think some of it is, teaching skills and teaching like a mental health toolkit almost, because we're taught what to do when we have a cold. Everyone goes out,
Yeah.
they get Lemsip, they get paracetamol, they get ibuprofen, they get lemon juice. We have this idea of how to look after ourselves when we're physically unwell, but we don't really get taught how to look after ourselves when we're not feeling mentally great. And I think there's so much value in really low level work in like schools and in even just working with families at like a national level, to get this idea that we can create young people that have this mental health toolkit that they can go through their young life with, remembering that it's going to pass, but not taking away from how bad it is right now. I think there's always a real fine balance between making sure young people feel heard, but also not minimising their experience and kind of saying, oh, it'll pass, or just a bad day. So not kind of minimising it, but actually saying, I know how really tough it is right now, and I imagine it feels like it's never going to end, but I'm wondering whether you'll feel the same as this in a week. And if you do, let's revisit it.
Just briefly mention, I think the best thing you can do in, not just in services but beyond that, just a whole general perspective, is hold on to hope, because when you start to lose hope, that's when things start to deteriorate.
Clinging on to that hope, literally clinging sometimes, is what helps people engage. Actually supporting someone through that crisis so that they can access the psychology, the social groups, whatever that they might need to get better. And I suppose Best for You is all about trying to put resources together and support young people in crisis and provide a bit of a space for young people and carers and professionals to see what crisis care is available.
When you say changing the narrative, I think the lack of conversation as well creates, stigmas and stereotypes as well, because me now, I'm 24, and coming from a bad place to a better place, you explaining this, it brings back so much of what was going through my mind at the time when, when I was at Child Assisted Health Service, psychiatry and so forth. It's exactly that, And actually, one of the questions that we saw from young people was, am I the problem?
It's a really common theme that is expressed by young people, unfortunately, quite a lot of the time. And I think there is many reasons for that. Sometimes, young people might feel that as part of their depression, or they might feel that as part of how their response by services are making them feel, or they feel guilty for the burden that they perceive to be put on services or their family. And it is trying to build them up to recognise that there is hope, you can get better, there is resources available for you. I think that young people are never the problem, it's never a personal responsibility. I suppose that's the reason that services are created in mental health, is that we recognise that often people feel like they're not going to get better, they're the problem, and they often find that they might go to a different hospital, for example, and feel that the same response I'm getting from services, it must be me, or I must be not doing something right. So I think it's also about positively reinforcing and creating a space that young people feel safe to express themselves, and also communicate with each other in a safe way. That shared experience is really powerful.
Definitely, No, I agree with all of that. And going through the psychiatric ward, right, and a lot of people asked me, like, being around other patients, how did that not make you feel like you were more ill than you actually were? And I said, actually, no, I learned more from them than I did my whole journey. And rather than just hearing it from a professional, from a clinical perspective, it's, we could sit down and we could have these conversations, know that we're both struggling somewhere, and it's like, actually, I had the same feeling, no matter how subjective the experience is, at some point through that experience, we will all feel the same emotions. And that's the main similarity I was quoting, we will all feel that anxiety, we will all feel that depression, we will all feel, whatever it may be. And so, if we're all feeling the same emotion at some point for our journey, but we're recovering, then definitely we're not the problem, right? I always tell people there's no such thing as normal. Normal is just something that somewhere, someone put into a social norm.
Yeah, I think what you just said there was really important. I think about self-compassion and taking your time. I feel like you're not really taught that actually it's okay to take your time.
Yeah.
And it's okay to like go off track if you need to. Anyone would rather you go off track for a year, 2 years, or 3 than, you know, be really unhappy but meeting all your, you know, expectations of yourself.
So looking at, you know, when we ask ourselves, am I the problem? Obviously, we want to look for a solution. We always don't find that solution. So the next good question, which really leads on from that young people want to find out, is, are there cures for depression and anxiety?
I guess the issue with the word kind of cure is that we kind of associate it with things that have a predicted end. The challenge with any mental health problem is that it's a little bit of trial and error, and I think sometimes it's very easy to lose hope because one medication or 2 medications, maybe even 3 medications might not work for you, or one type of therapy, 12 sessions might not work, but sometimes it's about finding a mix of things that all kind of come together to improve your well-being. Some people might find that they don't recognise it kind of going away, but they recognise how to manage it and have less impact on, you know, it has less impact on their life. But yes, especially in young people, you know, with the appropriate treatment, and that, you know, includes everything, not just kind of what mental health or CAMHS or Best for You, whatever can provide, but also the things like social factors, you know, relationships, family, you know, your general well-being, your physical health, all kind of coming together. You know, it can go away, it will get better.
And so when we think of, you know, cures and recovery, it's exactly as you said, you know, there's so much that goes into your recovery. It's not just, you know, I guess to the question, will I stop feeling depressed? Will I stop feeling anxious? I think, I'm going to stop saying I think because I'm actually sure about this. It's really just about managing it. That's where the issue comes in. Yeah. Same with depression.
Yeah, no, I completely agree. I think for some people there's a very clear trigger to depression or anxiety, and sometimes it is a trigger that can be removed, and therefore, you know, anxiety, depression can go away. But I think in any case, you know, I don't think we should take away from the other normal mental health experiences of people, which are, you know, low mood and anxiety are all within that. So I think, yes, it can go away. But I don't think it's about taking the depression or the anxiety away. But I think it's about learning to manage it, again, learning strategies, having therapy, putting into your mental health, because I think often it's so neglected that we don't realise we're neglecting it until we feel suddenly really, really low in mood, and then we realise like, oh, maybe I haven't been, you know, giving myself any time, and it's really hard to factor in that.
I think it's harder to recognise as well, because, you know, if we contrast it with physical health, like, you know, we get the symptoms that we know a cold is coming. You know, you start with a sore throat. I don't have to explain this. We know how a cold goes. But it's the idea, you know, that when we look at a mental illness, so for me and my schizophrenia, anxiety and depression were 2 things that were part of my schizophrenia, yet I didn't know it was leading up to schizophrenia. Does that make sense? I guess the point I'm trying to get at here is that, you know, when we look at curing, I completely agree, you know, we do seek this end, we seek this full stop, but it's not, you know, a full stop, it's actually an ellipse. Is that the free? Yeah, it's an ellipse, because actually recovery is a journey.
Thank you for having a chat. I actually really enjoyed this chat.
I really enjoyed it as well.
I feel like this should be a common, frequent thing.
I really enjoyed our conversation. As you said, the feeling's very mutual in that, and I appreciate the answers you gave. I'm sure it will help a lot of young people to understand, you know, anxiety and depression a lot better, and just, I hope, feel better to have that conversation with others, you know, and as someone who has a diagnosis, and as yourself who is as a professional in this space, you know, this type of conversations don't really come often, and so again, I'm very grateful. And
no, it's been great to have a chat about it, and yeah, hopefully Best for You can improve some of these difficulties that young people experience.
And arrange more of these conversations.
And more conversations.
Yeah, hopefully the conversations.